Welcome everyone to my page. Yeah, for today we are going to be talking about the last aspects of peptic ulcer disease. So, peptic ulcer disease, like we said in our last video, it is a breakage in the mucosal lining of the gastrointestinal tract, and the peptic ulcer disease it affects three parts of the gastrointestinal tract. That is the distal part of the esophagus, and then the lining of the mucosal lining of the stomach, that is the stomach, then and the anterior part of the anterior part of the duodenum. So if you have if you are viewing from YouTube, please subscribe, and if you are watching from TikTok or Facebook, please like my page. And then if you are watching or you are viewing for the first time, please follow my page so that you don't miss my upcoming videos. Yeah. And then if you are viewing from YouTube, please subscribe to my YouTube page. Yeah, thanks. So peptic ulcer disease will take on the first aspect. We'll talk about esophageal peptic ulcer disease. So with esophageal peptic ulcer disease, it actually means that there is gastroesophageal reflux. Yes, and then there's this leads now to damage the um, of the lining of the esophagus, which now will lead to what? It will lead to odinophagia. It's going to lead to dysphagia. You understand? That means you are going to be feeling pains while um swallowing. So so for the second aspect, let's see gastric ulcer. So gastric ulcer, someone is going to present to you that he or she feels, let's say he or she feels pain while he or she eats, epigastric pain, and then the pain goes after he or she finish eating. You understand? Such people are going to be like they're going to have weight loss. They're going to have nausea and vomiting. Yes, because in this another person is going to complain to you that which is peptic ulcer disease, that he or she feels pain after 2 to 3 hours after eating, and the pain is instead relief while he or she is. That is duodenal or a peptic ulcer. So this is the difference between the two. When they talk of peptic ulcer, let's say esophageal peptic ulcer is rare, but duodenal ulcer, peptic ulcer and gastric ulcer are the most common. So to differentiate between these two, that's duodenal and gastric ulcer, peptic ulcer disease, you see that when someone complains of both people presenting with these two different conditions are going to complain of epigastric pain. Yes, but one is going to tell you that the person with gastric ulcer, gastric ulcer or stomach ulcer is peptic ulcer is going to tell you that he or she feels pain while eating, and this is caused by what? Let's say like there's the mucosal lining of the stomach, any part of the stomach has been impaired by either use of what? Non-steroidal anti-inflammatory drugs. Yes, that's NSAIDs, or H. pylori infection. Yes, so since the mucosal lining of the stomach is impaired, there's going to be a lot of acid secretion and then pain too. So, but in the case of duodenal ulcer, since the person since when the person since when there's no food in the stomach, and there's acid secretion from the stomach, that acid secretion is going to move into the duodenum, and since there's an ulceration of the line of that lining of the anterior part of the duodenum, is going to cause pain. That's why the person feels pain 2 to 5 hours after, let's say, 2 to 5 hours after eating. But when the person is eating, the person does not feel pain, because that acid that was supposed to move from the leaf from the stomach and moves into the anterior part of the duodenum is no longer there, has mixed with the food. So the person will instead feel relief. And such people will instead put on more weight. But those people with gastric ulcer, who feel pain while they eat. Those people are instead going to do that, they're going to decide to fast, and when they decide to fast, they're going to lose weight. So that's the difference between the two. And then for the complications of this peptic ulcer, you see that in both cases, in duodenal and peptic ulcer, there's going to be perforation, and there's going to be um, bleeding. And in some cases, like for esophageal peptic ulcer, there's going to be stricture, yes, and there's going to be there might also be gastrointestinal bleed. So these are some of the complications. And um, between gastric ulcer and between gastric ulcer and duodenal ulcer, gastric ulcer is more malignant compared to um, duodenal ulcer. Now, if you have been watching this video, it means you have learned something about peptic ulcer, because some people always feel these pains, but they don't really know what they are suffering from. Some people will confuse saying that they have duodenal ulcer, meanwhile they have a gastric ulcer. So I'm sure at this stage you know what you always like experience or come down with in the name of peptic ulcer, whether it is duodenal ulcer or duodenal ulcer or gastric ulcer. So now let's look at the treatment options, what you can consider taking if you come down with peptic ulcer disease. So you can consider taking if you have H. pylori infection, if you have been tested and you have H. pylori infection, yes, you can take antibiotics plus proton pump inhibitors to eradicate the H. pylori infection. And then in the case of non-steroidal anti-inflammatory drugs like this NSAIDs, you should stop using them. Yes, you should stop using NSAIDs. And then you can also take proton inhibitor to reduce acid secretion. Yes. So thanks. Please follow my page for more. See you in the next video.